let's have a discussion on the very basic segments of the amputations. All right. So first, obviously, are the indications of the amputation. This is a kind of a topic which you are teaching with the hope that they are going to ask you this particular indication, because once all the signs of the livelihood are lost in any part of the limb, then it has to be eventually removed. Or you can wait for the gangrene to set in or gangrene to get established before removal, or you can predict that ultimately that limb or a part of the limb is going to be gangrenous and you remove it before the gangrene starts in. All right. So for the first time in INI CET examination, this question was asked about the frostbite management or the amputations in frostbite. All right. So let's discuss what is amputation. So first of all, it is the separation of a limb or a part of the limb through bone. All right, that is amputation. When you are separating it through bone, then it is called as amputation. Now, if it is through joint, when you are disarticulating it, so it is disarticulation. All right. Now, what are the indications of the amputations? Now, if we talk about the indications, all right. So, indications of the amputation can be categorized into two. One is absolute indication. Absolute means there is no other choice, you have to go for amputation. Now that amputation, absolute indication is a gangrene. Be it a wet gangrene, dry gangrene, diabetic gangrene, or any other reason gangrene. If the gangrene has set in, it is considered to be the absolute indication that you have to remove that limb or a part of the limb. All right. Then there are several relative indications. Relative means the causes which might ultimately result in a gangrene in that particular limb. All right. Now it could be a trauma, a very severely injured lower limb where there is a severity of the arteries, veins, the muscles, the subcutaneous tissue, everything is lost, and you think that ultimately we cannot salvage the limb, then you have to perform amputation. Similarly, infections. If the infection is at one stage gets untreated, means you fail to treat this kind of infection at any stage of given time, then that limb has to be amputated. Then tumor. You see, in some sorts of malignant tumor which are diagnosed early in the course of the disease, which has not yet metastasized, in order to increase the life expectancy or in order to decrease the morbidity on the part of the patient, you can perform amputation of that limb or a part of the limb. All right. Then the burns. These burns could be thermal or it could be electrical. All right. When a limb or a finger or any part is subjected to a thermal burn or a electrical burn, then it might also result in the severe injury to the vessels as well as muscles, which ultimately will reveal the gangrene. So in all these cases, you can perform the amputation. But one such relative indication is a frostbite. But how this frostbite is different from all the other relative indication that we have already talked about. In case of frostbite, despite not having any feature of livelihood left, you do not perform immediate amputation. You wait and watch. All right. So immediate amputation is never ever performed in a frostbite. So as far as frostbite management is concerned, the treatment of the frostbite is concerned, you have to remember these 3 to 4 points. Point number 1, that immediate amputation is never performed despite the fact that it is not having any sign of livelihood left. Even then you have to wait for some duration of time. Then how to manage it? The management will be based upon rewarming. Once you have treated the hypoxia of the patient, hypothermia of the patient, then you have to go for limb rewarming. So this limb warming has to be sudden. That means immediate rewarming of the limb is important. Then some local applications of silver sulfadiazine. And obviously, if there is any sort of a bandage or a wet clothing present on the limb, it has to be removed. So removal of wet clothing. All right. So first you have to treat the hypothermia. Then you have to go for the immediate rewarming. Late rewarming of the limb might invite inflammation, which will create a vicious cycle. All right. So rewarming, which is sudden, is of most importance. And then antibiotics. Obviously, antibiotics are to be provided in order to prevent the cellulitic abnormality and eventual infection. So preventable antibiotics are to be given. All right. So appropriate antibiotics. So this is how you manage it. Immediate amputation, this is the only indication where the immediate amputation is not performed. And this was asked in INI CET examination in 2022 May session. All right. So this is all about the indications. Absolute indication is absolute, that is gangrene, and rest we have talked about the relative indication. One relative indication, frostbite, is different because immediate amputation is delayed. It is not performed immediately. Then next thing that you have to remember are the eponymous amputations. You know, amputations which are named, which are given a different name. So these are categorized under eponymous amputations. So what are some of the eponymous amputations which could be likely present in your examination or could be projected in your examination? One is Syme amputation, S-Y-M-E. Now what is Syme's amputation? It is it is the above ankle amputation. That means it is the amputation which is performed through distal tibia and fibula, but it is 6 millimeters above the level of the ankle. All right, 6 millimeters above the level of ankle. If you are performing an amputation, it would be called a Syme amputation. Now, what is Syme amputation? Just try to understand. If this is the distal end of the tibia and this is the distal end of fibula, if you are performing an amputation at this level, that means 6 millimeters above the level of the ankle joint, then it would be called as Syme amputation. Then the second category is that of a Sermantio amputation. Second one is Sermantio amputation. Now what is Sermantio amputation? Here also you are performing an amputation through distal tibia and fibula. So it is amputation through distal tibia and fibula, but it is performed 13 millimeter above the level of ankle, and that is the only difference in between Syme and Sermantio. The 6 millimeter difference and 13 millimeter difference. So in case of Sermantio amputation, you also are performing amputation through distal tibia and fibula, but it is 13 millimeters above the level of ankle. This is Sermantio amputation. Then comes the another named amputation is C-H-O-P-A-R-T, that is Chopart amputation. What is Chopart amputation? It is intertarsal amputation. When you are performing an amputation at the level of foot in between the two tarsal bone, then it is called a Chopart amputation. Then a Lisfranc amputation, L-I-S-F-R-A-N-C, Lisfranc amputation. All right. So what is Lisfranc amputation? It is an amputation which is performed at the tarso-metatarsal level. So tarso-metatarsal amputation. All right. So these are the different sets of the amputation which could be performed, which are named amputations eventually. Although there are other also like Pyrogoff amputation, but no one has asked till date, and highly unlikely that the examiner will give you these eponymous amputations. The commoner ones are these ones: the Lisfranc amputation, the Chopart amputation, Syme, and the Sermantio amputation at the lower limb. All right. So these were the eponymous amputation. Next category is a topic which is known by the name of MESS, M-E-S-S. What is MESS? It is mangled extremity severity score. Mangled extremity severity score. Now, what is the importance of this severity score? First of all, imagine a patient is coming to you with a massively injured lower limb, and you have to decide whether to perform amputation or not. Then the score which is used to decide whether to go for limb salvage or to perform an amputation is predicted by mangled extremity severity score. All right. It has got 4 components. There are 4 considerations under this score. So it has got 4 components, and the 4 components are: 1, velocity of trauma; second, ischemia, that means ischemia of the limb. Third, shock. And the fourth one is age. Alright, so these are the four components which are taken into consideration and the score is calculated, and based upon the calculation the score could be less than 7, 7 to 13 or more than 13, and based on those scores it is decided whether to go for limb salvage or go for limb amputation. Although practically this MES score or mangled extremity severity score is not used for the purpose of management. Practically there are different systems which are utilized, but as far as your examinations are concerned, it is important because this has been asked multiple of the times in all India examinations also, like NEET PG examinations also. You see, they give you the options because they can ask this question that all of the following are the component taken into consideration in the mangled extremity severity score, except, this is how they ask this question. Alright, and they can give you these options. You know, we tend to form a mnemonic, we tend to create a mnemonic around every means whichever thing is kept in the form of the lines or in the form of a table, we tend to remember it with the mnemonic, and we are having a very renowned mnemonic for this mangled extremity severity score, that is VISA, velocity of trauma, ischemia, shock and age. But you know, examiner can change the language of these options. So they have asked the question with the changed options, like instead of velocity of trauma, they have written mechanism of injury. One and the same thing. Instead of ischemia, they have written perfusion in the options. One and the same thing, perfusion of the lower limb. Instead of shock, they have mentioned blood pressure, alright, in the options. So they have changed the option. So don't remember it with the mnemonic, try to remember it in the form, in the same form also, so that you can answer it accordingly with the alternatives which could be provided to you in the options. Age remains the same, alright, age remains the age in the options. There is no change in that particular option. So this is all about your mangled extremity severity score. The four components are important for in order to have a discussion over. Then, you know what, why terminal prosthesis? What is terminal prosthesis? Just try to, before we talk about these two different types of prosthesis, we will talk about that what is terminal prosthesis actually. Just try to understand. If the patient is having the disease and because of that the lower limb is amputated, a below knee amputation is performed. After performing a below knee amputation, when the wound is healthy, then you give a prosthesis. Alright, now that prosthesis would obviously going to be provided in the form of a leg. So this is an artificial leg. But this artificial leg is also going to have a terminal prosthesis, and that terminal prosthesis is a foot. Actually, the terminal prosthesis is a foot. That means artificial foot, the part of the prosthesis which is gaining contact with the ground. Now, these terminal prosthesis actually are of two types, although there are multiple other different types of terminal prosthesis. But for your examination, we are expecting that there is going to be a comparative ask question in between a very commonly used sack foot, which is solid ankle, cushioned heel, alright, a sack foot or a Jaipur foot. Now, as you can very clearly understand, because the Jaipur foot is something which is invented over here in our country, so it is having multiple various advantages. Like, what are the advantages of the Jaipur foot? We are going to consider. These are going to be the disadvantages on the part of the sack foot. So, Jaipur foot was devised by Dr. P.K. Sethi. Alright. Now, Jaipur foot actually is made up of a rubber. It is not a solid. It is not a wood. It has not the wooden component. It is made up of rubber. As a result of which, it is to some extent pliable. And that is the reason why the patient can perform squatting is possible. Wearing a Jaipur foot, the patient can squat because the rubber is relatively more pliable. So, ankle dorsiflexion is possible. Then, the possibility of walking on irregular terrains